Hello everyone and welcome back to the channel. I'm Dr. Richard Miller, and if you have been following along with our conversations here, you know I'm not here to lecture you. I'm here to talk with you like I would in my exam room, with honesty, warmth, and a deep respect for what you've already been through in life. Today, we are diving into a subject that comes up in my practice almost every single week, and it deserves our full attention. We are talking about Risperidone, often known by the brand name Risperdal. If you're over 60 or if you're caring for someone who is, this conversation could quite literally change the quality of your days and the peace in your home. I have been practicing medicine for nearly 20 years now, and I've seen how these medications can help in certain situations, but I have also watched them quietly steal pieces of people's lives when we are not paying close enough attention. That is not meant to scare you. It is meant to arm you with knowledge so you can walk into your next doctor's appointment feeling clear and confident. Let me say this right at the beginning. I'm not against medication. Some of my patients truly benefit from carefully managed treatment, but I am against unnecessary medication, especially when it turns a vibrant senior into someone who is foggy, unsteady, or withdrawn. Our bodies change as we age, and the way we respond to powerful drugs like Risperidone changes too. Understanding that difference is one of the most important things you can do for yourself or for someone you love. Think about it this way. When you were in your 30s or 40s, your body was like a busy airport running at full capacity. Flights took off and landed on schedule. The control tower worked perfectly, but now in our 60s, 70s, and 80s, that same airport has fewer runways, the radar sometimes glitches, and the staff is working with less backup. If you send the same powerful aircraft through that system without adjusting the schedule, things start to back up. That is exactly what happens with many medications in older adults. Risperidone is what we call an atypical antipsychotic. In younger patients, it is often used for schizophrenia or severe bipolar disorder. In older adults, it is frequently prescribed off-label to help with agitation, aggression, or difficult behaviors that can sometimes come with dementia. The intention is good. Nobody wants to see their mother or father pacing the halls at night or becoming upset and unsafe, but here is what many families do not realize. The older brain is far more sensitive to these medications than a younger brain. Our liver and kidneys clear drugs more slowly. The protective barrier around the brain becomes more porous, and the very receptors the medication targets can react more strongly than expected. I have sat with too many families who thought the sudden decline they were seeing was just old age or the dementia getting worse, only to discover that a medication was quietly making everything heavier. The good news is that once we recognize what is happening, we can often turn things around. Not overnight, but steadily and safely. Let me tell you about Arthur. He was 76 when I first met him, a retired mechanical engineer with a quick wit and a gentle smile. His wife had passed a few years earlier, and his daughter noticed he was becoming more restless in the evenings. He would wander, repeat questions, and sometimes become agitated. The specialist they saw prescribed a small dose of Risperidone to take the edge off. For the first couple of weeks, it seemed like a blessing. Arthur slept through the night. The pacing stopped, but then something shifted. He stopped wanting to eat. His balance became so poor he could barely make it from the couch to the bathroom without holding on to walls. He no longer asked about his grandchildren. The spark that made Arthur, who he was, simply dimmed. His daughter brought him to me in tears. Convinced the dementia had accelerated overnight after a careful review, we slowly reduced the Risperidone. Within 6 weeks, the fog began to lift. He started eating again. His walking improved. The man who loved building model trains began tinkering in his workshop once more. The dementia was still there, of course, but the medication had been amplifying the symptoms and adding new problems on top. This is what we call the prescribing cascade. One medication creates a side effect that looks like a brand new medical problem. So another medication gets added, and then another. Before you know it, you're taking a handful of pills that are working against each other instead of helping you. I have seen this pattern so many times that I now look for it automatically. Other patients have shown me different faces of the same issue. Margaret was 81 and living in an assisted living community. She had always been social and loved playing cards with friends. After starting Risperidone for mild agitation, she became so drowsy she slept through most afternoon activities. Her friends thought she was depressed. In reality, the medication was simply too strong for her system. When we adjusted her regimen and brought in some simple behavioral supports, she was back at the card table within a month, laughing again. Then there was Robert, a former Marine who prided himself on his independence. The Risperidone prescribed for nighttime agitation caused such severe stiffness and shuffling in his gait that he fell twice in 1 week. One fall led to a broken hip. The surgery went well, but his confidence never fully returned. These are not rare stories. They are the daily reality I see in practice, and they are often preventable. So what should you be watching for? The signs are not always obvious. You might notice a new unsteadiness when walking, a persistent brain fog that feels different from ordinary forgetfulness, excessive drowsiness that makes it hard to stay engaged in conversation, loss of appetite, tremors or muscle stiffness that were not there before. Sometimes it even shows up as emotional flatness, like the person you love is there but somehow less present. If you're noticing these changes, please do not assume it is just aging. Bring it up. Ask questions. Your voice matters. Now, if you or someone you love is currently taking Risperidone, hear me clearly. I am not suggesting you stop it on your own. Abruptly stopping these medications can create its own set of problems, including rebound agitation, sleep disruption, and in rare cases, more serious withdrawal effects. The right approach is a thoughtful conversation with your physician and a carefully monitored plan. The first thing I recommend is what I call the brown bag check. Literally gather every single medication bottle in the house. Prescription drugs, over-the-counter pills, vitamins, supplements, even that occasional melatonin or allergy medicine, put them all in a paper bag and bring them to your appointment. Do not just read from a list. Let your doctor see the actual bottles. This simple act often reveals interactions or duplications that no one had noticed. When you sit down with your doctor, I want you to ask direct but respectful questions. Start with curiosity rather than confrontation. You might say something like, "Doctor, can we talk about why I'm still on this medication and whether it is still the best choice for me at this stage?" Then follow up with, "How might this be affecting my balance, my thinking, or my energy?" And the most important question of all, what would a safe way to reduce or eliminate this medication look like? And are there other approaches we could try first? I have found that when patients come prepared with a 2-week symptom log, the conversation changes completely. Keep a simple notebook by your chair. Each evening, jot down how your energy was that day, whether you felt steady on your feet, how clear your thinking felt, how well you slept, and any moments of agitation or restlessness. Bring that notebook with you. It turns the appointment from, "I don't feel good," into, "Here's the data I have been tracking. Doctors respond to data." We have learned so much in recent years about non-medication approaches that can make a real difference. Simple changes in environment often help more than people expect. Bright light exposure during the day, dimmer lighting in the evening to support natural sleep rhythms, consistent daily routines that reduce confusion, music that brings back positive memories, even something as practical as a weighted blanket or comfortable chair that provides a sense of security. Physical movement is incredibly powerful. Gentle chair exercises, short walks with a companion, or simple stretching can reduce restlessness dramatically. Nutrition matters too. Making sure there's enough protein, B vitamins, and omega-3s can support brain function. Staying well hydrated is surprisingly important. Dehydration alone can make confusion much worse. Some of my patients have had wonderful success with pet therapy, either a calm dog or even regular visits from a therapy animal. Others respond to aromatherapy with lavender or engaging in meaningful activities that match their lifelong interests. The key is to treat the whole person, not just the behavior we want to change. I often tell my patients to think of their health like a garden. You would never pour the same amount of fertilizer on your garden in January that you use in July. You watch the plants, you adjust to the weather, you prune what is not helping. Medication should be approached the same way. Risperidone might have been the right tool at one point, but as seasons change, we need to reevaluate. The goal is always the lowest effective dose for the shortest necessary time, or ideally finding a place where medication is no longer needed at all. This process takes patience. Tapering usually happens gradually over weeks or sometimes months. We monitor closely for any return of symptoms and adjust as needed. The brain appreciates stability when we give it time to adapt to lower levels of medication. It often finds its own balance. Again, I have watched people in their 80s rediscover joy after reducing their medication burden. They read books again, they enjoy meals with family, they laugh more easily, their personalities return. It is one of the most rewarding parts of my work. I also want to acknowledge how hard this can be for caregivers. Watching someone you love struggle is exhausting. If you're in that role, please be kind to yourself too. You cannot pour from an empty cup. Support groups, respite care, and simple stress reduction practices can help you stay strong enough to advocate effectively. Before we wrap up, I want to leave you with a few clear principles to carry with you. Your brain chemistry is not fixed. It changes with time, and our treatment should change with it. Always look at your medications as an interconnected system rather than separate pills. And above all, prioritize function over sedation. If a medication makes you quieter but takes away your ability to walk safely, enjoy a conversation, or recognize your family, then it is not truly helping you. I would love to hear from you in the comments. Tell me about your own experiences with medication reviews. Have you successfully tapered off something with your doctor's help? What non-drug approaches have worked in your home? Did keeping a symptom log make your doctor visits more productive? Your stories help every person watching this video feel less alone, and they help me understand how these issues show up in real life. Thank you for spending this time with me. It truly is an honor to share what I have learned over these many years of practice. If this conversation gave you some clarity or hope, please consider subscribing and joining our community here. We have many more honest discussions coming about how to age with strength, dignity, and as much independence as possible. Remember, you're not just a patient, you're a person with wisdom, history, and the right to ask questions about what goes into your body. Stay curious, stay engaged, and above all, stay well. I will see you in the next video, my friend. Take care.